Skinner. I'm a physical therapist and I have hypermobility. I also specialize in chronic pain and complex conditions, including hypermobility. I wanted to share with you today a research article that I recently found and read and was really excited about because it's one of the first places I've seen actually connect a lot of the variation of symptoms that I hear from my clients. And that includes issues with like swallowing and talking, elevated heart rate, gut and motility issues, and that connection is actually the vagus nerve. Now, if you've never heard of the vagus nerve is a nerve that goes from your brain stem, it's a cranial nerve, and runs all the way down through your throat and chest into your gut and your stomach area. And it has receptors down there. The vagus nerve is a two-way street. And so what that means is that it helps control your gut from your brain in terms of affecting how the movement and stuff is working when you have more stress and anxiety. Think about public speaking and get that like pit in your stomach and everything kind of tightens up and you feel nauseous. That's the vagus nerve. But what people don't realize is that the vagus nerve also runs up, which means depending on how your gut is doing, it has an effect on your depression, anxiety levels, and particularly like right now there's such a stressful environment going on in the world, it can play a larger role than maybe what it was in the past or has been. So that's why I felt like this article was so pertinent for right now. Now, to give you a couple of the highlights with it, it's a review article in Frontiers of Psychiatry, and it's called The Vagus Nerve as a Modulator for Brain-Gut Axis in Psychiatric and Inflammatory Disorders. Now, that at first glance may not seem like it's really relevant to a lot of people. If you don't feel like you're in a psychiatric diagnosis area or and have an actual inflammatory disorder, but there's an awful lot of us that have gut issues, that have high inflammation levels, autoimmune disorders, as well as have noticed, when your anxiety level and your stress level goes up, your inflammation level also goes up as well. So there's definitely correlations for a lot of people. Now, it is a review article, so what that means is they looked at all the research that had been done and tried to compile it into a summary, which is really exciting. It also creates some limitations in that if things haven't been studied yet, and there's still so much more for us to learn about nerves and about the vagus nerve. So there's going to be limitations in how much information is in this. But the biggest things that I wanted to share with you is that vagal tone, so that vagus nerve, is correlated with your ability to manage the stress response. It can be influenced by breathing, and you can improve it through meditation and yoga to improve your resilience and control your mood and anxiety symptoms, which is great. A lot of us know we should meditate more and be more mindful, and this just gives us some more scientific proof that that's a good thing to do. Other functions of the vagus nerve is that it controls most of the muscles for swallowing and talking, for everyone who's been complaining about feeling hoarse. It supports the heart to decrease your heart rate, for everyone out there who's got complaints of tachycardia. In the intestines, it controls muscle contraction and gland secretion to increase motility, and so that's when you're feeling constipated and your gut is just not moving, you're not digesting well. That vagus nerve can have an effect on that. And also reflexes such as coughing, sneezing, swallowing, and vomiting. So for everyone who's having issues with those kind of things. And inflammation, it has the ability to suppress inflammation. So if you have an autoimmune problem, or if you're someone, and I see quite a few of these types of individuals where you don't have a technical disease, but you have high inflammatory markers, the vagus nerve works with your gut to help decrease the inflammation in your body, which I feel like at this point all of us can use more of. And that microbiota, so the bacteria in your gut, is important for your immune and nervous system function, and that you can improve that with nutrition. So what this study really means to you is that we really should be monitoring our internal state, so our stress level, to help our physical health, and that there is a definite correlation. It also means that taking a probiotic, and that's actually in the study, can be helpful for inflammatory conditions including rheumatoid arthritis and colitis, which I felt like was fairly interesting. And you may want to look at options for meditation. There's a lot of great apps out there to help support that vagus nerve function. And like I said, there are limitations. It only looks at what research has already been done in the past. It was from 2018, so fairly recent. But there are also other nerves that cover these same areas. So even though your vagus nerve does influence your gut, you also have what's called an enteric nervous system, which is a whole massive nervous system in your gut. So for sure, the vagus nerve is not the only thing that affects that. There are also other muscles that are come in to affect swallowing. There's other factors that come in to affect your heart rate. And so it's not the only thing that's going to affect all of those. But for so many people, we have multiple symptoms that correlate, and it can be really helpful to know that you might have one issue that's affecting all of these things, particularly when it's a functional problem, which means it doesn't happen all the time. Sometimes it's worse, sometimes it's better, and it gives you something else to kind of look at. And so I really feel like the take home is just that vagus nerve is essential to that brain-gut axis, and it's important for controlling your inflammation, maintaining your intestinal function, hunger, energy levels. I know a lot of you complained about being tired, heart rate, swallowing, talking, and we really need to watch and protect that vagus nerve with good nutrition, probiotics, mindfulness, stress management, and that it may be playing a larger role in our health than what we have realized. So take a look at the link, check it out if you're looking for more information, and send me articles that you found that you feel like are helpful. I would love to take a look at them as well. We'll see you next time.